Yeah, my name's Kait, and I am Senior Partner and VP of Fuse Health Strategies. I'd like to introduce my actual business partner, Steve Davis, who's sitting up front taking video. He's a psychiatrist from Baltimore, and we are a consulting concern that talks specifically to groups about how to best integrate behavioral health care. And what I'd like to do today is talk about why we are going to do that. You guys have probably all heard about the triple aim, I'm sure. Whole person care, better outcomes, cost savings. Those are big deals, and that's the only way we're really going to get any change in our healthcare system. Mind and body, totally inextricable. As long as we continue to talk about somatic care and behavioral health as separate entities, we are going to continue to get bad outcomes because we are not disconnected at the neck, believe it or not. In the next slide, I've got, and you guys can get a copy of this from Aquilent, but this is all about relative risk of medical admissions for people who have mental illness or substance abuse issues, also under the title of behavioral health, along with co-occurring or comorbid physical health issues. A person with, for example, chronic health, or congestive heart failure is 6 times more likely to be hospitalized if they have a behavioral health co-occurring disorder. 6 times more likely. Now that means that that person is using up an incredible number or amount of services. And that's just the top 6 or 7 diagnoses. So it's about cost, it's about savings, it's also about the patient center. If we're talking about patient-centered care, what does it look like? What are the top requirements? Collaborative care models. Collaborative care models are the only way you're going to get patient-centered. I work on the National Quality Committee for Quality Assurance, NCQA's standards group for their new patient-centered medical home standards. And this is the #1 thing that we talked about, is collaborative care. And you can see what that really means. Cost transparency. One of the big things that's happening right now in the Twitterverse around health, at least the health people I follow, is they're talking about cost transparency, because if we don't know, if patients don't know how much something costs, we can't help change it. We can't help change what we're spending. What are the barriers? We're talking about clinicians, and you guys, you're like all HIT people, right? None of you do anything other than HIT, right? Because, you know, that's why we're here. Basically, we're talking about what's stopping us from being patient-centered, and we don't have data access, or we don't have access to our data via portals. You guys can fix that. You guys can encourage your companies to build portals. You can encourage your business office where you work to say, hey, we want data portals so that we can be involved in our care. Next thing, docs. Not always comfortable, especially primary care docs, not always comfortable treating mental health issues. You know, they go in and they're like, how you doing? And that's their assessment of your mental health. We need a more complete picture. And so one of the things that I do is I do social media for a company called M3, which is M3 Information or M3 Clinician. And what's my M3? They are, M3 Clinician is the clinician side of a tool, a multidimensional, evidence-based, scientifically validated screening tool for all of those things. Depression, PTSD, bipolar disorder, which is really likely to be missed if you use the typical screen, which is called the PHQ-9. And then also if you add on, there's a substance abuse or substance use disorder addendum. And with that, the right tool can save the life. I mean, we're really talking about saving lives here, because if your primary care doc is seeing you and they don't see the whole of you, the behavioral part of you too, they could miss a really important piece, the part above the neck. If I have any questions, I'll take them later, but thank you so much for the opportunity to sit down or stand up and talk about what I do. And if you would like to talk more about the psychiatric side, Steve Davis is a psychiatrist, so you can, get with him later. Talk to you guys later. Thank you very much.